And then O'Donoghue maneuver is a combination of we're doing passive range of motion at the end of the range. So I'm doing something like this. Now, if he's feeling pain when I'm pressing overpressure at the end of the range, what types of tissues do you think would that indicate? Nerve tissues, yeah, ligaments, joint pathology, something like that. So now I'm going to have you press into my hand. Don't let me move your head. Okay. So that would be if there's a problem with some of the flexor muscles. And then, so you're putting one hand here to stabilize here and then one hand here. So then here, going this way like that. So press back into my hand. And the other thing, when you're doing these like manual muscle testing or resistance testing, the language that you use, and the biggest thing is if you tap against these, so you're giving some kind of stimulation as to where you want them to push. Instead of saying, all right, I want you to try to press your head backwards, you don't want to say like, I want you to extend your head. Basically you say, press back into my hand, don't let me move your head. So you're doing that to give them stimulation. It's going to go a lot smoother and faster than if you're just stumbling through the words to try to explain to them what you're going to do. So say, I want you to press over on this side into my hand. And press over here. I want you to try to turn your head this way, look to the right. And then same thing over here. Okay. So it's the big thing is this tapping. I mean, you don't have to smack them upside the head, but just tap and say, I want you to press into here. And then the shoulder depression test is that you bring the head to one side like that, and then you're putting pressure down here. Okay? So I'm stretching this brachial plexus on the ipsilateral side. And then if you have symptoms on the contralateral side, like I said, it could be facet problems. And then the Valsalva test is pretty self-explanatory. You just have the patient breathe in, take deep breath, bear down as if they're trying to move their bowels. You're looking for an increase in symptoms. Now that could be radiating pain down the arm if it's a cervical disc. Could be lumbar pain radiating down the leg if it's a low back disc problem. If it's a tumor or somewhere that's putting pressure on the nerve, you're going to feel it in different areas.
So what is the Valsalva test? What's the mechanism?
Basically, you have it's a test for what's called intrathecal pressure. There's a thecal sac that surrounds the whole spinal cord, and then also the nerve roots as they exit. So basically, you're just pumping up the pressure in that whole sac that surrounds the spinal cord. So anything that is putting pressure on the spinal cord or the nerve roots is going to, the increased pressure is going to reproduce symptoms.
You could also ask if there's pain on the spine during boundary.
Yeah, that's one of the things in the history form. A lot of times you'll ask, is there any change in your pain with sneezing, straining at the bowel, coughing, laughing, things like that. All right, now this one, Soto Hall test, a lot of times is done supine, where the patient's laying on the back and you stabilize the upper thorax here, and you just bend the head forward like that. All right, so then if you've got the Lormetti sign, a lot of these nerve traction types of tests, they escalate. Excuse me, see one thing, so now we're stretching the spinal cord from the top part here. Okay, what we do is get it from the other end. So now we're going to have you extend the leg out like this at the knee, and then we're going to have you plantar flex the foot. I'm sorry, dorsiflex. Up this way. Actually, the patient's not going to do it. I'm going to be pulling it like this. So I'm dorsiflecting. So basically, I'm just adding to that traction the whole nervous system, spinal cord, and then the nerve going down like. So you could just have some local pain in the neck versus pain going down into the arms, also pain going down into the legs. And then we mentioned the swivel chair test. Basically, I don't think we're already swivel chair on this count, but basically, when the chair moves and the head stays stationary, you're testing the artery, but leaving out the inner ear. And if you turn the head like this, you're checking the inner ear and the arteries. So you're looking for what kind of symptoms do you get with vascular conditions to the brain? Dizziness, nausea, nystagmus, different things. And then, like I say, the vertebral quadrant test, that one will do later when we get the tables out. But basically, if he was laying on his back, you'd extend, and then laterally flex and rotate to the same side, and just have him stay in that position. And remember, he would be laying down. So basically, you're going back like that. All right, so then we'll practice those. Okay, so these are, yeah, basically those are all the different tests. So first let's go through the frontal compression series and the Donahue maneuver. So we'll just stick with the ones that are on this slide here. So then these first four ones are going to be considered more of a primary thoracic outlet tests. And then the secondary ones are going to be more specific for specific symptoms. Versus if it's, if you have, if somebody says that I get these symptoms when I put my hands overhead, you're going to do tests for you putting the hands overhead. If they say I get problems when I carry heavy bags, then you're going to do something that reproduces that mechanism of injury. But the first couple ones are more basic tests, and then the other ones are more specialized. So most of these that involve doing the pulse, the first thing you do is you're going to palpate the pulse and assess it before you start moving the head or the shoulders or the arms or whatever. So you're going to check the pulse, then you do the maneuver, whether they're turning this way, turning that way, breathing in, holding the breath. So then you're looking for a change in the pulse and or a reproduction of the symptoms. So then Allen's test is basically you're going to assess the blood flow to the hand. So what they're going to do is make a fist, a couple times like this, pump it, hold the fist. Then you're going to put pressure on the radial and the ulnar arteries. And you open the hand, then you open one side, and you're going to look for, watching the redness is going to kind of go in this direction. Then we're going to do the same thing again. Make a fist. Hold the arteries. Now we're going to release on the ulnar side. So then the redness should kind of flow this way. So that's just basically to get a baseline assessment of what kind of vascular return do they have. Is maybe the radial artery more dominant, which is typically going to be the case. I mean, you palpate the pulse more on the radial rather than the ulnar. So that's just a baseline test to assess the blood flow into the hand. Okay. Be honestly though, really don't really do that test. I mean, if I'm going to do thoracic outlet, I'll just go straight to these tests here. But if you're having trouble with, if you suspect that the patient, maybe they're diabetic or they have symptoms that are going to lead you to suspect that there's decreased circulation, then you might do that test. But you need to know how to do it for this class, but I wouldn't say it's really used that much. Question? No. All right. So now with these other tests, what you want to pay attention to is which way is the head moving in relation to the arm that you're testing. Okay? Adson's sounds kind of like adduction, which is moving towards. So Adson's, I'll usually remember it that it's moving towards that same side. Is there anybody else want to come up that